Yeah, trendsetter, whoa, league of my own, it don't get better. No, read what I wrote, I'm a bestseller. Yeah, reach for my goals, hit it dead center, hit it dead center. Bullseye, hit it the most, is no misses. Something like fish in a barrel, it's no different. Blindfold on me, I still got the most vision. Trendsetter, total.
Hi, good evening everyone. I'm Dr. Srishna from Drools team and we are delighted to have you all join us for today's webinar organized by Drools in collaboration with Indian Association of Veterinary Dermatology India. Thank you all for taking the time to attend this session. And to begin, we have Dr. B. Nagarajan to deliver the welcome address and set the stage for today's webinar. Before we start, I would like to request everyone to please fill out the form in the comments box to receive your certificates. And now I invite Dr. B. Nagarajan to deliver the welcome address. Over to Dr. B. Nagarajan.
Hello. Good evening to everyone. See, I'm very happy to meet you all again after a long time. See, it was a big hit. You know very well, we have got a very great response for our ICVD 5 at Kolkata. And I'm very much thankful for each and every one of you who has attended there, and you might have enjoyed everything. All the scientific thing were fantastic, and it was a very great presentation. And even the speakers were very much thrilled over that occasion. So they were very happy, and they said it is a very great event. It is equally good as we are doing in America or UK. We are doing a wonderful job. Like that, they have appreciated, and we will keep rocking over that. And you know very well, we are going to have it in our next ICVD 7, I mean 6. That is our 6th Indian Congress for Veterinary Dermatology is going to happen in Hyderabad. We'll prepare everything for it, and we are going to have a very good speakers for that. And we started doing work on it, even though it is 1 year. We'll be doing always 1 year ahead for all the preparations. So in the meantime, we'll be having our own webinars, our own workshops, and also the dermatology camps, everything, even the in-person lectures, everything we'll be doing it. I seek your cooperation. And you know very well, in our practice, we are going to have always very most of the cases are dermatological cases. Even though we have a lot of cases, we are not approaching in a systematic way. It is a very simple thing. There is no expense in it. We are going to have one microscope, on cellophane tape, on this thing, picking up the hair. Like that, we have got even wood lamp. All these things are very reasonable rate, and we can get it and keep in your practice so that we can apply it. See, particularly the cytology, always I used to say cytology and scraping are two eyes of the dermatological diagnosis. In the cytology, the trichogram is also one of the important thing. So trichogram, you can see very well so many things. We may not know that. That's why we wanted to have this particular webinar exclusively for trichogram. Particularly, you know very well, our Vice President, Dr. Venkateswaran, is very good in parasitology, particularly in dermatoparasitology. He is having an enormous interest, and he used to post a lot of ticks and its eggs, and also the trichogram, everything he used to do. So that's why we thought we can have one webinar exclusively for trichogram, so that it can be easily followed in our regular practice, so that everyone can be easily identify the problems and go further, and it will have a very great success in practice. And if you are going to show it to your client on the microscope, you can see the trichogram. In that, you are seeing some attached pneumothorax, or even the any alopecia related thing, like even the we have color dilution alopecia. In that, melanin cramps will be there. So those things, if you are going to show to your client, they'll be very much impressed on you, and they'll be having a feeling of scientific approach. So that's a very important thing in our practice, so that you'll be confident in your practice. You can diagnose properly and do the work properly. Thank you very much for your wonderful attentive nature of the thing. And we keep doing all the webinars in future. And I also thank our knowledge partner Drools for this wonderful arrangement and other thing. And I request Drools team to introduce our Vice President, Dr. Venkateswaran, before his delivering speech.
Yeah, thank you. Thank you, Nagaraju, Dr. Nagarajan, sir. So now it's time to introduce our esteemed speaker, Dr. S. Venkateswaran. Dr. S. Venkateswaran graduated from Madras Veterinary College in 1985 and completed his postgraduate diploma in ultrasound in Chennai. With more than 3 decades of experience in small animal medicine, he is a partner at Cotton City Pet Clinic, Coimbatore, where he has been practicing for the past 22 years. And his special interest lies in veterinary dermatology, particularly parasitic skin disorders. He currently serves as the Vice President of AVD and SAPAC Tamil Nadu, and has attended several continuing educational programs at both national and international levels. So now we hand it over to Dr. S. Venkateswaran for his expert session on combing alopecia through trichogram, a practical non-invasive diagnostic tool for dermatological disorders. Over to Dr. Venkateswaran.
Thank you, Drools, for introducing me. I'll share my screen. Good evening, ladies and gentlemen. First of all, I thank the knowledge partner, Drools, to introduce me in this. And then the topic today we have selected is, of course, as our Professor Nagarajan said, dermatology is almost around 30 to 35% of our practice. And in that, every day, we will be getting a question, Doctor, my dog's hair is shedding, my dog's hair is shedding. Alopecia is one of the very common one. And in that, of course, in India, we lack in most of the diagnostic facilities. Maybe part of it available in the metros and tier 2 cities, it will be a lesser only. Now, in that, even trichogram, through trichogram, now we can diagnose many things which we are going to see today in this webinar. Trichogram, it's also called as a trichography. It may be a non-invasive or a semi-invasive. A semi-invasive, we can say that because we are plucking the hairs, some amount of minor pain will be there. So it's a semi-invasive, and it's quite easy and fast. Say that is within a minute or two. Now we are going to pluck it, see it in the microscope, and then we are going to see the diagnosis of it. So through the trichogram, we are going to analyze the hair anatomy, the hair growth cycle. So through that, we are going to confirm part of the diseases like dermaticosis or dermatophytosis. We will be doing it in a confirmative one. In the other things, it will aid in our differential diagnosis. For a trichography, what all we require is glass slides, mosquito hemostat. So sometimes when you use a mosquito hemostat, we may be damaging the hair shafts. In such cases, we can have a rubber covering also along with that. See, you can see the rubber covering. So this will prevent the damage to the hair shaft. And then next, using a sellotape, no, because after plucking, sometimes it might fly. You may have to fix it in a mineral oil, or you can stick it onto the cover slips and then transfer it to the slide, and then we can see it. Potassium hydroxide, or it's useful whenever you are looking for dermatophytes. Marking pencils to mark the slides, of course, microscope, and blue black ink. This is also useful whenever you are going in for dermatophytological examinations. And the last one is chlorolactophenol. It's a combination of chloral hydrase, lactic acid, and phenol. So this is of a questionable use as far as most of the countries or most of the places. Chloral hydrous will be very difficult to procure. You may have to require special licenses and all. So if at all, if there is a possible, you can use them yet to digest the material, which makes it easier for the trichogram. And how about to go about it? Say after plucking the hair, they should be placed in the same direction so that we can see the entire roots in the simple place and then entire shafts in a simple location. Same thing the tips also. Supposing if you are looking for Demodex and if the hairs are longer, you can clip the hair because we are going to see only the root. So in such cases, you can clip the hair and then pluck it and then you can use it. Of course, as I said, rubber covering to prevent the damage to the hair shafts, and air circulators. The thing is, if they are blowing, so after you moment you pick it up and then before you could place it in the slide, it might blow off also. So better not to use an air circulator, or nearby let us not use this usage. And then the thing is, whenever you are having an alopecia or any other symptoms you want to see, pluck the hairs from the edges of the lesions. And supposing if you're going to do it in the nail beds, say nail beds mainly, you will be looking for dermatophytosis or a pododermaticosis also. In such cases, you can even procure from multiple doses, and preferably for a good sample, you can use 30 to 40 hairs can be plucked and then you can use it. And better, no whiskers should never be plucked. And then after plucking the hairs, you place it in the mineral oil, or you can place it in the potassium hydroxide or ink or even a lactophenol, and then start seeing it from 5x. And in 5x also partly you can see the parasitic eggs in it, and 10x also you can see. And if you want to go further, you can go with 40x and 100x. And then in the trichogram, now we are going to see the hair anatomy, the hair shaft, as I said. Now, first thing, the hair anatomy, the hairs are made of keratin only. And then the hairs, they start from follicles, which are placed in the dermis. And then in every follicle, you will have one primary guard hair. And then along with that, 3 to 15 smaller secondary hairs are also there. And then the hair shaft starts from the epidermis, which is seen outside. It has three parts: cuticle, cortex, and medulla. And then the root, when you pluck it, you will be plucking it and then you can see the root. And below the root, the dermal papilla is there, which is supplied with capillaries and nerves, and the nutrient supply is there for the hairs from there. And sebaceous glands are also present, and the muscles to hold the hair erect. And then when it comes to the hair shaft has got three stages. The outer layer is cuticle. It protects the inner layers, and the cuticle is transparent and it gives the shiny appearance. If there are any damages in the cuticle, no, you cannot see a shiny, you cannot see a lustrous appearance of the hairs. And the innermost layer is medulla. Sometimes some of the hair shafts you cannot see it, the medulla, and the medulla contains the large cells. And then between the medulla and the cuticle is the cortex. The cortex contains the pigment and the keratin, and the cortex only determine the bulk and the strength of the hair. And then the hair types, there are different types of hairs present on the dog's body. The guard hairs are the outer coat. They are long, always thick, and the guard hairs only protect them from the dirt and the UV rays also, and they determine the coat color. The hair shafts, the guard hairs, the colors determine the coat color. And the secondary hairs, which are very small and soft, and they are very finer. The secondary hairs, they are very dense, and they are the ones which gives the insulation against the cold and heat also. And the tactile hairs, that's another one, also called as a viscous. They are the sensory ones. Invariably, they are present in the face, and they are highly innervated, and they sense it, helpful in sensing any pet. And then coming to the hair follicle functions, the hair follicles, they are helpful in thermoregulation, and they are physical, and they even go for the immunological protection also, and they are help in sensory perception, social interaction, camouflage. And then the hair follicles are lifelong capacity. They are formed in the birth, and then they remain lifetime, and from there the hair follicles keep on coming. And then when you look into the trichogram, now we have to look for the defects or how they are present in the root, how they are in the shaft, and then the tips also. Coming to the hair root first, the hair in the genetic dysplasias, the hair roots are the one which are always disturbed. And then after the structure of they alter the structure of the hair shaft also. When the roots are affected, the hair shaft is not properly formed, it alters the structures of the hair shaft. And they are often seen in follicular dysplasia, color dilution dysplasia, and alopecia dysplasia, alopecia X. And then coming to the shaft is always uniform in diameter. They tapers to the tip. That is, the broader one slowly tapering to the tip. And the curly and the wavy shaft is there in the bridles, like poodles who have a curly hairs. And then the hair shaft only gives the pigmentation. And then as far as the defects in the hair shaft, we can see the genetic defects, structural defects, and because of that, they are very brittle, they break, and the loss of hair is there, and the dullness is also seen. And most of the times, you can see the trichorexis nodosa in the shaft. Whenever they are prone for any injuries or trauma or any other insults to the hair shaft, the trichorexis nodosa is present. And then before that, it goes in for the trichomalacia. You can see it. The trichomalacia is the structure of the medulla and the inner parts are damaged and making them to break. And then in the hair shaft, you can see the epithelial casts which are present in during some of the nutritional deficiencies. And then in the hair shaft only, you will be able to see the ectoparasite along with their eggs. And this is the trichomalacia. And then the trichorexis nodosa, that is, they break, and then it looks like as if it is being tied up, and then they break and then give way. And then the hair tip. Now, when you come to the hair tip, now it should be perfect. It should end in a pointed face. If it is not so, you can see the breakages there. Normally, these type of breakages are seen whenever they have a pruritic problems. Now, when they keep on chewing or when they keep on gnawing, especially in the cats, the owners may say that my dog never had any pruritic. No, but when you look into that, when you see the breakages in the hair tip, it shows that it has some pruritic problems. And the split ends, you can see it is called as trichoptilosis. And most of the golden retrievers, genetically also, they will have these sort of split ends in the hair tip. And then coming to the hair cycle. Now, through the hair cycle also, we can go for a diagnosis. And the hair cycle starts with anagen. It is the growth phase. Next, it goes to the catagen, which is a regression phase. And then the telogen, or the resting or quiescence phase. And then it goes for shedding, which is an exogen. And whenever you look into any hairs, you will be seeing a mosaic pattern. Now, because every follicle will have a different stages of the growth cycles of it. Maybe one, it will be an anagen, the other follicle may be in a catagen. In that way, a combination of all the things will be there. So that's why it's a mosaic pattern. And then coming to the alopecia, and because only through the alopecia, we are going to look for these trichogram. And the alopecia can be either an inflammatory alopecia or a non-inflammatory alopecia. But trichogram you can attend, but every patient with whether it is an inflammatory or a non-inflammatory alopecia, which will aid in your diagnosis. As far as inflammatory alopecia is concerned, invariably it is focal or a multifocal. It is asymmetric. Maybe in one side it is present, not like the other ones. And inflammatory alopecia is often pruritic, and it targets the hair follicle, it for the shafts, and even the sebaceous glands. And the inflammatory alopecia, normally it is in self-mutilation alopecia, dermatophytosis also, it's an inflammatory alopecia, and then the parasites like Demodex, pediculosis, and termites. Of course, the others also cause alopecia, but in trichogram, you are going to see the Demodex, pediculosis, and the termites, Ciliatella, and trauma. And non-inflammatory alopecia, it is always a generalized one, not a focal or a multifocal. Invariably, it is symmetric. That is, both sides of the body it is present, and invariably it is non-pruritic. Maybe in the later stages, with the secondary infections, it may become pruritic. In non-inflammatory alopecia, invariably it is due to the impaired hair cycle you can see, which is visible in the trichogram. And as far as non-inflammatory alopecia, normally you can see it in follicular dysplasia, color dilution dysplasia, autoimmune diseases, post-clipping in adults, alopecia areata, post-injection vasculopathy, traction alopecia, endocrinopathies, chemotherapy, glucocorticoids administration, estrogen administration, anagen and telogen effluvium, light exposure, metabolic diseases. In these things, you can see a non-inflammatory alopecia. And of course, I am going to go for it, each and every one, and how trichogram will be there in each of these conditions. And then coming to the root, in the root, you are going to see in all the phases, the anagen also, anagen, catagen, telogen, how it will be. In the anagen phase, it is very soft, it is rounded, pigmented, pigments, you can see the entire thing. Often, when you are plucking it, it will be a brunt one, and sometimes you can even see an onion-shaped root also. So whenever you are seeing this, it's the hairs are in the anagen phase. The next one, catagen. In the catagen, the root becomes a spear shaped, and it will be always rough and non-pigmented most of the times, and it is invariably straight. It is not bent in the end. And in the telogen phase, again, it will be a spear shaped only, and the total loss of pigment in the bulb, and it will be having a brush like edge. You can see them in a higher magnification. And then coming to the inflammatory one, in the self-mutilation. So self-mutilation normally happens whenever there are ectoparasites on the dog's body. It could be a tick, flea, louse, or mites. And then you can see it in acrylic dermatitis, also the self-mutilation you can see. And chemical irritation could be a floor chemical or the other chemicals which come into contact with them. And in atopy also you can see a self-mutilation. And in self-mutilation, in the trichogram, you will be seeing a mixed cycle. Mixed cycle in the sense you can see an anagen root, you can see a telogen root, you can see the catagen root also. But invariably, the tip you cannot see it, it will be a broken one. And in this particular case, now it's a cat, it came with an alopecia in the tail, and nowhere, no other symptoms are there and no lesions. And I was thinking that it could be a dermatophytosis. And then I saw that in the wood lamp, now I couldn't find any fluorescence. Then I thought, now maybe I can go for a trichogram. I can see the dermatophytes or a hyphae or the arthrospores. But when I plucked and then when I saw, now I saw plenty of notodress. In fact, this is not a very common one. This is not a procedure for a notodress, but even in a trichogram, you can see this. And then, of course, in self-mutilation, you can see in the sarcoptes and the flea bite allergy and the chemical irritation. So when you go for plucking of the hairs around it, now you can see the features of the trichogram. And then the next in the inflammatory, dermatophytosis. In the dermatophytosis, the loss of structure of the hairs will be there. And in the shaft, you can see the spores and hyphae. So after you going in for the wood slamp examinations, you can pluck the hairs which have the fluorescence. You can keep it in the mineral oil. Again, you can see it. Again, you can see the fluorescence in that, and then you can see into the trichogram also. In the trichogram, you can see the hyphae and the spores. See, as far as dermatophytosis is concerned, now you can have the diagnosis of the fungus, but the species of the fungus is not possible, for which you may have to go for a culture. But in many places, the culture may not be possible in smaller towns and other things. In that, even a trichogram, even when it is negative with the wood slamp, you can diagnose the dermatophytosis. And then in Demodex, of course, now even yesterday also, or those who are in the IAVD members group, now you could have seen a wonderful presentation by Dr. Nanjundappa, almost plenty of Demodex sticking onto the hair root. But in cases where you cannot go for a scraping, especially around the eye or in the digits, or sometimes the owners may not be willing to go for a scraping. So in such cases, you can go for a trichogram. Using a trichogram, you can even diagnose Demodex. Now you can see it here. The one egg is attached to the root of it, and then from that, you can see that the Demodex mites between the hair shafts are sticking on to that root. Also, you can see it, and then now, this one actually one of a wonderful presentation like everywhere. This was pictured by my colleague in my clinic, Dr. Subramaniam. And whenever when we went for that trichogram, we saw a Demodex sticking onto that, dancing along with that hair shaft. And then next, now whenever you see a salt and pepper like appearance on the shaft of the hair by the naked eye, or sometimes it could be dust, sometimes it could be dander. But to confirm it, if you pluck a hair and then you can see the eggs of the louse on the hair shaft. And in that also you can find it out. See, in this you can see the embryo is present inside the egg. It's a before hatching, and after hatching you can see again the eggs is sticking onto that. So in this particular, whenever you find out that they have these pediculosis, sometimes even any pesticide shampoo or any other applications will not be able to clear completely the nits or the eggs from the hair shaft. In such cases, you may have to go for a close haircut to control this louse population. Of course, the louse, they have the entire life cycle on the dog's body itself. So after diagnosing this, if you go for a close haircut, you can totally eradicate the louse from that animal. And then the fur mites also, you can see it's very common. We are seeing it in our place in Coimbatore, the Linsacarus radowskii, Cailiatella. And in that, you can see the adult as well as the larva and the eggs also in the attached to the hair shaft. And then Cailiatella. So that also, in that you can have a differential diagnosis. Say like almost the eggs of Cailiatella, eggs of fur mite, and the other fur mite, Linsacarus radowskii, or the louse, they may be very similar. The previous slides you can see in the fur mites, you can see a longer egg completely sticking onto the hair shaft. And then in the pediculosis also you can see it, but the structure varies. But in the Cailiatella, the eggs will be sticking, only a part of it will be sticking on to the hair shaft, the other will be hanging outside. So in that way also, even if you are not seeing the Cailiatella mite, by seeing the egg also you can diagnose Cailiatella from the trichogram. And then in the inflammatory one, again, the trauma also causes these problems. The trauma could be due to the burns, after the surgery, scratching, chewing, friction, pressure sores, leaking, and psychogenic also. In such cases, invariably, the trichogram will be showing a broken tip. So like these things, you can see the broken tips due to trauma. And then, of course, when you in the differential diagnosis, this will help you. And then the drugs or the chemical exposures also. Even today, yeah, I think last week, our president also posted one, the exposure and the floor chemicals, the spot-ons. In this particular one, after the usage of spot-ons, we saw that alopecia remaining for more than 2 months. And the hormones, they also can cause alopecia. Hormones, it could be direct or from the pet parents when they use it for their skin condition, and the vet and the pets are having a close contact with the pet parents, they can get alopecia. Glucocorticoids, they also will cause an alopecia. And in these things, the hair cycle disruption is there. And of course, the poodles, terriers, and old English sheepdogs, they have these common. And in anagen, in these conditions, you can see an anagen effluvium. Of course, I will be explaining anagen effluvium in the coming slides. And then even a poor management also will cause a excess shedding. So in this particular case, you can see we have removed almost like the skin is removed from an animal like. So when they are dirty, when they are not combed daily, then excessive mating is there. When the excessive mating is there, it aids in the bacterial growth and then goes for an excessive shedding. Now in these cases also you can see only the telogen hairs. And then whenever you are going in for a plucking, now you may be seeing both the anagen and telogen hairs also. So based on that also you can go for a diagnosis. Supposing in your plucked hairs, if it is only anagen, invariably in puppies, when they are in the growth phase, we will be seeing only the anagen hairs. And in normal adults, it should be a mixed one. So you should have a mixed of anagen and telogen. And the ratio varies based on the breed also. In the poodles have a prolonged growth phase. So in the poodles, you will be seeing more of anagen and less of telogen. And in Nordic breeds like Siberian Husky or the Malamutes, though they have a prolonged quiescence, that is a prolonged resting phase, wherein more of telogen will be there and less of anagen. And the ratio again varies with the season. With the season, like say in the colder season, you will be seeing more of a telogen. They will be sticking on to that, giving protection against the cold. And whereas in the summer, and the telogen falls, and you will have a lesser telogen and more of anagen. And the management also, again, as I said, if they are not managed properly, you will be seeing more of telogens only. And in physiological conditions also, you will be seeing it, like pregnancy, the post lactation, the ratio varies, wherein in those conditions the telogen will be more and less of telogen. And in topography of the animals, of course, they are less than animals, whereas in the human beings only, you can see, say like your eyebrows and other things will have, they will be having a variation. Only in the growth phase will be there. The other one, you can see the telogen. But to find out the anagen and telogen ratio, a minimum of 100 hairs should be plucked and they should be seen, and you can go for a diagnosis to find out with this ratio. And then in your trichogram, if you are seeing only anagen, it is an anagen effluvium. And of course, as I said, it is common in pups. And in impaired nutrition, will have it. Say when the nutrition is not proper, you will be seeing only the anagen one. And in drugs, in the chemotherapy, you are going to see only the anagen, because in the chemotherapy, the mitotic action of the follicle is disrupted. So they will not be reaching it properly. So once they reach the epidermis level, they fall. So you will be seeing more of anagen. They will not be going into the catagen and telogen. So chemotherapies, especially like doxorubicin, cyclophosphamide, and fluorouracil, they all cause these problem, anagen effluvium. And as I said, the cessation of mitotic activity, it goes to the abnormal hair follicles and shapes, and they break on reaching the skin surface. So in your trichogram, you will be seeing only anagen, so which is called as an anagen effluvium. And of course, this is very rare. Now, only in the puppies, when you pluck it, you will be seeing it, or in a chemotherapy, you will be seeing this. Now, otherwise, maybe in hypothyroidism also, you can see an anagen effluvium, which I will explain in the coming slides. And the anagen effluvium is only short-lived. It's not a profound, as I said, you will not be seeing it more. And only when they have a hair growth cessation, you can see an anagen effluvium. So in that, what happens is that a small defect in or a band happens in the hair shaft, weaken the hair, and they break or fall within 2 weeks. The telogen hairs are not affected. So the trichography varying lengths of hairs. And in your plucked hairs, if you are seeing only telogen, it is called a telogen effluvium. So in this, there is a synchronization of the hair cycle happens. So in the synchronization, a quicker formation of catagen and quicker formation of telogen, and it falls. And in that, you will be seeing an easy epilation, and you can see a sudden heavy loss. So this is the one which we commonly in fact hear from most of the pet parents every day. My dog is shedding more hairs. So in that, the nutrition plays a major role, because when there is a lack in proteins, now the hairs they will be having a telogen effluvium will be there. And in the endocrine dysfunctions, and like post lactation or even in adenocorticism, now you will be seeing a telogen effluvium. And in hypothyroidism, in the later stages only, you will be seeing this. And metabolic disorders also. And the stress could be even a light exposure, or when you have a pyrexia, 2 months after they recover from it, you can see a telogen effluvium. And in this, no, the telogens, they all the telogen hairs, they fall before the anagen hairs come to the surface. So that's the reason you are seeing a lesser amount of hairs or the lesser amount of plumage on the dog's body. And the telogen effluvium, as I said, it happens when there is when the dogs are exposed to the stress, pyrexia, pregnancy, post-lactation, surgery. Even in some of the dogs, where after the anesthesia, this happens, shock, severe illness, the light exposure. The light exposure, now you can see the dogs which are kept outdoors, they will have a lesser hair shedding than the dogs which are kept in indoors. Because the indoor dogs, they are exposed to the light almost say like in every house. Now we go to bed almost like 12 o'clock or 1 o'clock, and during those times the dogs may be sleeping along with you on your room, or they will be also playing along with you. When they are exposed to the halogen lamps, the fluorescent lights for a longer time, they also shed more. That's a telogen effluvia. And the telogen deflection, now in that the abrupt premature, as I said, the anagen hairs are not coming to that, and before that the synchronization takes it, and there is a heavy loss of telogen, and that is an abrupt premature. Cessation of growth, that is anagen hair follicle. Synchronization, quicker synchronization to catagen and to the telogen, and that is shedding. And normally these type of shedding, they are in large numbers. They can even happen over a period of 1 to 3 months. And all follicles are involved in this. Even face, distal limbs are also affected. In the anagen deflection, no, you will not be seeing it in the face and the distal limbs. Whereas in telogen, even the face and distal limbs are also affected. You will be seeing alopecia almost in the entire body. So in the telogen deflection, in the trichography, you will be seeing only telogen hairs. When you are seeing only telogen hairs, you can think of these things. And based on the clinical symptoms and the other factors which are going to diagnose, will help you in differential diagnosis. And then when you come to that follicular and color dilution dysplasia, of course, normally this is not seen, nor very rare only. It's a genetical one. It's a hair shaft defect. In this, you will be seeing the trichorexis nodosa, and then the melanin clumping will be seen. Now, this is one of the, whenever you see this melanin clumping, you can diagnose it as a color dilution dysplasia or the black color follicular dysplasia also in this. Now,
मैम हो
because
गया
otherwise, you can confirm this only with yeah, a histopathological diagnosis only, and which may not be possible in most of the places. But with the trichogram, you can confirm it as a black color follicular dysplasia or a color dilution dysplasia. And in some of the autoimmune diseases like vitiligo, now, of course, vitiligo, you are going to see it. In the vitiligo, again, in the hair shafts, the pigment loss will be there. You can see it. and melanin clumping also you can see it, and in UVO dermatology, UDS also you can see it. In that you are having a loss of melanocytes in the hair follicle and leading to the pigment loss in the shaft, and you are seeing the leukotrichia. And of course in pemphigus foliaceus also you can see in autoimmune, again the UDS, you can see the loss of pigment in the hair shaft and leading to that. And in pemphigus, and in post-clipping alopecia, especially in the double coats, the dog like Siberian Huskies or the German Shepherds, these are all very common. Even in poodle also, after the post-clipping, you can see this. And predominant, you can see only the telogen. See, when you are seeing the alopecia for a longer time, and especially when you see this only predominant telogen, that is a telogen effluvium, you can think of post clipping. Of course, this also can be diagnosed medically to bring it back to the normal one. And again, another autoimmune disease, which is very rare. Of course, I have not seen it. And you can see the lesions in the face, head, and legs. And in that, when you go for the trichogram, you can see a broken tip, and black and yellow dots also will be seen in the hair shaft. And in the root, you can see the exclamation point. Whenever you see this exclamation point, is one of the gold standard, I can say, the diagnosis for alopecia areata. And post-injection vasculopathy. Sometimes, mostly after the anti-rabies vaccine, you are seeing that ischemic reactions in that capillaries, they are affected, and the blood is starved to the follicle. The follicle don't get the blood supply properly, and leading to the defective roots and to the defective shaft, leading to the fractured hairs. And again, in this post-injection vasculopathy, in the trichogram, you will be seeing only the telogen hairs, the telogen effluvium will be there. And this is another one, the traction alopecia. And nowadays we are seeing more of Shih Tzus. Of course, they come with a beautiful the comb. The hairs are combed with the headbands. Also, they are there. But when they are there, they are subjected to a chronic pulling and damaging the hair roots as well as the hair follicles also. And in the tight collars, they would have applied that collar. It's, I would say, a poor management. It will be completely pressing on the one and causing the damage to the hair tips. And sometimes even a rough grooming also can cause it. Now, in that, whenever in the trichogram, you can see trichomalacia, distorted shaft, and then the changes in the follicle. But when you see it in the trichogram, you will be seeing a normal anagen and normal telogen ratio also. Along with that, you will be seeing trichomalacia, that is changes in the hair shaft like this. The trichomalacia, you can see it. But in this, you will not be seeing a fractured tip. Tip will be normal. Only the hair shaft will be affected. And then in endocrinopathies like hypothyroidism, in diabetes mellitus, and in hyperadenocorticism, you can see the telogen phase only. And in the trichogram, it's a telogen effluvium. Of course, this is not the confirmative diagnosis. Along with your other investigations, the trichogram also will help you in diagnosing the endocrinopathies. And the chemotherapies and the drugs, they also cause the problems. Now in that, in the trichogram, you will be seeing only the telogen follicles. And in the season, the longer telogen is there in the winter because they have to protect them against the cold, and the shorter telogen in summer. And the longer telogen, of course, it is more in outdoor dogs rather than the indoor dogs. As I said, the constant light exposure would make them shed. And even some of the breeds in the Nordic areas, now they have seen a complete hair coat during the winter and total loss of the hair coat when the winter goes, when the summer comes. And in that also, you can diagnose it through the trichogram. And as I said, the light exposure, normally the dogs in the outdoors, they shed the hairs only once or twice when the season changes as far as India is concerned. Whereas in an indoor dog, it's a continuous one because of the light exposure. And along with that, the hormones also, they play a role, the artificial lighting. In these things, there is a disrupted hair cycle, and which is very common with the halogen and the fluorescent bulbs lighting, which normally we do it in home. No? And in the metabolic diseases, of course, all the metabolic diseases, they are disrupted, and sometimes the nutrition is affected, or directly also they can cause it. And of course, I saw in one of the article in the hepatocutaneous syndrome, I saw in one of the cases also, in fact I forgot to include that. In that you will be seeing a distorted shaft, and the cuticle is also lost in this also. Of course, combining with your other investigations, this aids in the diagnosing hepatocutaneous syndrome. And in the nutritional origin, again, no, in fact, this particular puppy, I saw it's in a biotin deficiency. Later, when we diagnosed, the dog was on completely on a raw egg. And in that also, you can see the telogen deflections will be there. Trichorexis nodosa and follicular cast also will be there in vitamin A deficiency. And in even sebaceous gland deformities also, you can see the follicular cast, which are all a pathognomonic one, I can say. Of course, this also you can see it in dermaticosis and even in dermatophytosis also. Combining with the clinical symptoms, you will be able to diagnose them. And you can see the follicular cast also in this. This particular one is the zinc responsive dermatosis. The dog was on completely on a vegetarian diet, of course recovered with zinc supplementation. But in these things you can see the follicular cast and the damages in the hair shaft. Again, in the hormonal origin, so this particular dog is on a pseudocyesis, and because of that there was a lots of hair shedding. You can see only the telogen effluvium. So in this, the milk secretion, the pregnancy is not there, and there are no itching. The alopecia with the telogen deflection, you can diagnose that. You can differentially diagnose it that this is not the cause for any other problems, and mainly due to the pseudocyesis. Of course, this regresses and then again comes back in the next cycle when they come to the pseudocyesis. And this particular dog, now it had a sertoli cell tumor, wherein you can see that alopecia symmetrically and in the perineal region. Again, in these things, the trichogram, of course, this is not the confirmative one. This also aids in, you will be seeing only a telogen phase. A telogen effluvium is one of the symptoms in the cell tumors which cause this. And then, of course, in the breeds, the Siberian Huskies, Golden Retriever, German Shepherd, they shed a lot because of the double coat. The primary hairs, you can see it shedding. The secondary hairs will be there. And in the Poodle, Maltese, and Shih Tzus, because of the long anagen, they will be having a less shedding. And then the breeds like Chow Chow and Pomeranians, they have a less shedding because they have a longer telogen. And I thank everyone. And in fact, I thank my family, my mainly daughters who have helped me in preparing this. And then I thank the knowledge partner Drools and thank AVD for giving me an opportunity to present this.
Thank you so much, Dr. Venkateswaran, sir, for that insightful and detailed practical session.
Yeah.
And with this, it's time for our interactive Q&A session. And if you have any questions for Dr. Venkateswaran or the AVD team, please drop them in the chat box. We will take one by one. Dr. Akhilash is writing treatment for acrylic dermatitis.
Yeah, of course, acrylic dermatitis, that's more of a psychogenic problem, or when they have a problems in the joints in that particular area, they will go for it. So we have to diagnose them. If it is due to any trauma, we can go for the specific treatment, or psychiatric drugs can be given to prevent them by putting a collar around the neck so that we can prevent the leaking also.
All right. So next question is, had a chemical burn in a cat due to lime sulfur. So what can be done in this case? Will the hair return?
In the chemical burn, if the follicle is not damaged, definitely the hairs will return back. And then if they're treating with the secondary bacterial infections and emollients, definitely it should be back. Maybe if we go for a histopathology, if the hair follicles are not damaged, definitely the hairs will come.
Next question is how to differentiate zinc responsive dermatosis and demodicosis.
Scraping.
Yes, definitely. Demodicosis, of course, by a skin scraping or a hair plucking, we are going to see the mites. So when you are seeing the mites, you are seeing the demodicosis. And then the zinc responsive, of course, it will be a hyperkeratosis will be there. And moreover, it is called as a zinc responsive. That is, by supplementing zinc, if you are going to change the lesion, it is called the zinc responsive. And invariably, it happens when the dog is on a vegetarian diet, when they are not given a non-vegetative protein. Probably Professor Nagarajan might add to this.
Yeah, zinc deficiency, whatever form of thing which is not having zinc, then it will have a zinc deficiency. Particularly in certain breeds like Husky, will be having this because majority of the cases where there is a nutritional imbalance, you'll be having this zinc responsive dermatosis. So we can very well see the response by supplementing the zinc. So no need to confuse yourself. So the
Right.
demodox you can easily identify by skin scraping itself. So no need to, there is no big diagnostic thing. By seeing the clinical signs and doing a skin scraping, you can very well identify the demodox.
All right, sir. So next question is how glucocorticoids are causing pruritus.
Glucocorticoids are causing pruritus.
Glucocorticoids. No, they will not cause pruritus. The shedding of hairs will be more. After the
Okay.
glucocorticoid administration, it affects the hair follicle, and then the hair roots and the shafts are defective. So that's the reason you have a shedding hair. But once it is removed, the hairs will come back again.
And
It
also when you
doesn't
are
cause a
going to have,
pruritus. It
when you
affects the
have a
hair shaft
parasitic
and root.
infestation, see, whenever you have a parasitic infestation like scabies or demodex, if you are going to give steroids, thinking that it is not a parasite, without seeing a skin scraping, they will proliferate more and it will have more chance to see. Even if you don't have any scraping negative, but strongly suspecting the symptoms with the parasitic disease, if you give a glucocorticoids immediately after giving a glucocorticoid, they will proliferate more. If you are going to take a skin scraping, you can very well see the parasites under microscope. So the glucocorticoid, in case of parasites, it will aggravate. So easily it can create a scratching. That is the thing we can expect in which we should not do. But if we do, it will go for scratching because of more proliferation of parasites.
All right, sir. So one last question we will take. How to differentiate a telogenic phase follicle from a damaged follicle?
See, a damaged follicle you are not going to see in the trichogram. So that is only in a histopathology. Whereas in a telogenic phase, you can see the telogenic roots are there. Telogenic roots will be a longer one without pigmentation, and the tip will be looking like a brush.
You can always think like this. Telogen means non-pigment. That is, non-pigment means at the base of the root of the area will not be having the pigment. That is, telogen means pigment. Telogen means non-pigment, whereas anagen means pigment. So TN, Tamil Nadu, you think of Tamil Nadu, so you can think of telogen non-pigment. Whereas Andhra Pradesh, if you think AP, that is anagen with pigment. So these two things you can see under the in the area of root area. That is just at the base of the hair follicle. You can very well identify with or without pigments. So with that, we can see whether it has got a rounded tip or it has got a brush tip. With this, we can identify whether it is a telogen or anagen. As doctor was giving photographs with the brush and also with the earbud, like end of the tip will be rounded and a little bend. Sometime it will be looking like an onion, like that. He was showing some photos. So that is the way we have to clear. So you can easily identify, you can have it in mind as telogen means non-pigmentary, that is TN. Anagen means pigmentary AP, like that you can very well remember. So easily we can identify by seeing the root of the hair. In the root, you will be having the pigment or non-pigment. That is the thing, not in the other area. Okay.
So one more question we'll take. So Dhanashri, she's asking, do we need to use shaver for clearing long-haired dog that is unable to wash dog every month? And please give solution also. There is too much of dandruff problem.
Yeah,
So it is a
first thing,
long-haired dog.
the
Yeah.
hairs are the first thing, the hairs are the one which protects them against both heat and cold, UV radiation, and they protect against the dirt. So normally the hair clipping is not advised. Maybe when they have a tuft, when they are going to treat the skin, they can go for a shaving. Otherwise, it is not needed. As far as dandruff is concerned, now we have to find out the root cause for it. It could be any infections over the skin, or it could be a nutritional problem. I think for the dandruff's sake, we need not have to go for shaving or sharing the hairs.
All right, sir. So thank you so much, Dr. Venkateswaran sir and Dr. Nagarajan sir, for answering all those questions patiently. And now it is the time to conclude our session. And we invite Dr. Kanyappan, who is Joint Secretary AVD, to deliver the vote of thanks.
Good evening, all. It is my privilege to propose the vote of thanks on behalf of AVD. First, heartfelt thanks to our speaker, Dr. Venkateswaran sir, for sharing valuable expertise and for engaging everyone so thoughtfully. Your insights on combing through alopecia will continue to guide and motivate us to implement it in our day-to-day practice, sir. Thank you. Thanks to our knowledge partner, Drools, for your generous support, and to the team for ensuring everything ran smoothly. Finally, to all participants and attendees, your presence and contribution made this event meaningful. Thank you.
Thank you so much, Dr. Kanyappan. And it is the time to wrap up today's session, and a gentle reminder to fill out the form in the comments box to receive your certificates. And thank you once again, all of you, for joining us for today's webinar. We look forward to seeing you at our future sessions as well. Have a great day ahead. Bye.
Thank you.
Thank you.
You know, my friends and I, we talk about everything under the sun. So how can we leave out discussing something as important as our pets and their diets?
Always remember to check the back of the pack when it comes to buying food for your pets.
Make sure that you're feeding only real and clean ingredients.
It is 100% real chicken.
No byproducts
Or fillers.
All natural, all healthy ingredients.
It gives them the best of both, taste and nutrition.
rules.
Drools. Drools.
Drools.
Drools.
Drools. Feed real.
Fitly.